The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, taking stock in you, and this is Health Futures. And if you're listening today, it must be Friday. We come in on every Friday here at Money Radio Studios, live from the Scottsdale Air Park Studio, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. If this happens to be the first time you are tuning into our show is about how our older adult population can live a healthier, happier life. And how do we do this? We do this by bringing incredible guests to the show, and today's no different. I am really pleased to have back in the studio with me, and I say back, he was here in June 19th last year, Dr. Ashish Sachdeva. Dr. Sachdeva, thank you for coming back to the show.
Thank you, Bob. Thank you for having me.
And may I refer to you as Ashish?
Absolutely.
Ashish, it's so good to have you. You are the founder and run a practice called Pinnacle Care Internal Medicine.
That's right.
And you shared with me that your original location's in Sun City, but you have now expanded to a new location, and there's a third one coming.
Yes, absolutely. We have actually, during the pandemic times, fortunately, our practice has grown, and we are opening our second office in Sun City West on 1st of July, and looking forward to opening a third location in Glendale.
In Glendale.
Yes.
Wow.
Yeah.
Fantastic. Well, you know what? There's a great need out there. And I will tell you, you inspired me the last time you were here. I mean, you know, you made me feel good about myself, and I know that your patients feel that way. And I'm not violating any personal health information, but you did share with me a text message that you got from one of your patients like at 3:45 a.m. in the morning. And
Yes.
and you responded to them at 3:47 in the morning. And that says a lot about you and the practice that you lead.
Oh, thank you so much. It's health care, in my opinion, is not just taking care of their physical needs. It is a all-encompassing, care, physical, mental, spiritual, social. So I think if we can give them that support, it helps not only the patient but also their family.
And that's the thing I recall about our get-together was that whole, mind, body, spirit piece that you really, you preach it, but you practice it. And it is amazing. And I remember you sharing with me that you were creating a foundation. You since have done so.
Yes. Actually, my wife, who is also my partner both in life as well as in my practice, and myself, we have been growing in our scope of the practice and have realized over the years how important it is to have a wholesome outlook to healthcare. And so we decided to open this foundation. It's called the Wholesome Living Initiative Foundation. And like the whole word says, our focus is on the whole person. So looking forward to doing something useful for the society.
Well, the one piece I want to tackle right off the front is the social piece, because this last year has been really tough for all of us. I mean, you would never know if you would walk outdoors today. I mean, Monday, the Arizona Diamondbacks opened it up to full attendance. And, I'm watching the games, even the NBA games and the Indy 500s this weekend.
Yeah.
and they say there are going to be over 100,000 people there. And last year there was nobody there. All you could hear were the tires of the engines on these cars.
True.
So we've started
Opening up.
but.
Right.
But what has it been like for your patients and for you as a practitioner with the social piece that has been so missing?
Healthcare, like the initiative that we are starting, the Wholesome Living, I think the focus should be on the upstream factors rather than just taking care of the healthcare system. So there is a growing understanding that outcomes in health is more determined by these upstream factors rather than just the healthcare system. For example, it depends on where you grow, where you live, where you work, where you play, where you age. So it is important to understand the challenges and then to troubleshoot and partner with various people in the community. So the challenge is not just to take care of their physical health when they come in, diabetes, blood pressure, all that is important, but to also understand what social interventions should be included. And I think a focus in the future should also be to have these included in the medical costs. So that because it is going to make a huge difference. I say this with maybe, let's see, a cost per patient for a member, per member, I should say, for an insurance company,
Right.
should be around $300 or at the max $1,500 per patient, including all the medical problems and psychiatric problems. Now, if this patient's social needs are not taken care of and the patient ends up in the ER, the cost is going to skyrocket. So if we can take care of these upstream issues and have transitional care available so that we can avoid these costs, I think it'll help the whole social setup.
Describe for me and our listeners, when you refer to upstream issues or factors, what are you referring to?
So, like I said before, it depends on where patients grow, live, work, play, and age. So, for example, if I have a patient that doesn't show up for an appointment, if I have a system in place to find out what the issues are, whether it is transport issues, money issues, isolation, depression issues, why is the patient not showing up? So if I have a system in place where I can have my staff call them, which I have in my practice. I have used already the facilities which are available through Medicare and others, like the chronic care management program or the collaborative care program, where we have a social worker in our office who is touching base with patients with anxiety or depression or any psych problems once a month, and just touching base, and spends maybe an hour. I don't have that much time.
No.
But these people have the time,
Right.
and then they send a report back to me to say, doc needs help, having problems with this. And then I can marry up their issues with a community-based program or a foundation that is working with us, like on the west side in the valley, we work with the Sun Health Foundation. They have been great partners.
They're actually my guest next week.
Oh, wonderful. They have been instrumental in, so they have people called as, I use them mainly for my dementia patients. So
Right.
they have memory care navigators.
Yes, they got a really good one that we all know as Marty. Marty
yeah.
does a
I love
wonderful
Marty
job.
Finley. Yeah. So we have her go to these people's homes, and then she sends us a detailed report as to what are the social determinants that she thinks are coming in the way of this patient's or the family's, care. So that is one. So, and also when we find out issues of housing, loss of employment, social isolation due to social distancing, or food problems, food and security is important, but I think employment, job training, life skills is so essential. So health plans, in my opinion, should also take the initiative. We shouldn't just leave everything to the state. We
Right.
have to have them also have people assigned to help them with the, transitional housing, etc. Now, when we are able to get funding for all these things, same for my foundation, and I also use my website for, in the future also, put in job opportunities, etc. We have volunteers who will help transport patients back and forth. So the health plans should invest in maybe transitional housing, have the money for case management, peer support, behavioral health, training. And then you can partner with us physicians, the local setup, the local hospitals, the local community organizations. So it'll be cheaper to invest in this rather than going to the ER. The return on investment may be not immediate, but it is going to help us in the long run. Like I gave you the example of the $300 and the $1,500 per member. And then if we add the cost of the ER.
And that would be per year.
Per year,
Per year.
absolutely. Now, same thing with our, when we find out there is issue with drug abuse or alcoholism. So we have to, I love this, I read it somewhere, look at the causes of the cause of health problems. So that is the upstream.
Right.
The causes of the cause of the health problems.
Right,
That's a wonderful thing which completely, says it all. So
And I'm going to say this because I know we're coming up on a break,
Right.
and like I said, I love your passion,
Right.
and it all goes back to what we talked about when we first started, is the fact that you're all about not just the physical health, but the mind, body, and spirit, the mental, spiritual, and social aspects of health, and you're advocating for it. You're talking about it. I want to learn more. I know our listeners want to learn more. We're down one segment. Dr. Sachdeva, we got 3 more to go. We'll
Sure.
be right back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I've got Dr. Ashish Sachdeva. He's got a wonderful internal medicine practice called Pinnacle Care. And if you're interested in learning more about Pinnacle Care, go to pinnaclecareinternalmedicine.net. We will be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we're in our second segment here. And I've got Dr. Ashish Sachdeva, and he is with Pinnacle Care Internal Medicine. And I got to tell you, I'm just so captivated by having you here in the studio with me, Dr. Sachdeva. You inspire me, and I can only imagine what you do with your patients. If you missed our first segment, go up to our website at cypresshomecare.com. Click on the media button, third button down is radio show. You'll catch that first segment, and you'll also catch many, many more. So, Dr. Sachdeva, when we left off, you were talking about, how health plans should really invest in really helping these members, because they call them members, with a lot of the social determinants of health, and really, helping them cope with some of the challenges. But you take that on yourself. You were talking about your social workers, how they check in on your patients and seeing how they are doing and where they're at. We were talking in that first segment about, the social aspect. I mean, you talk about physical, mental, spiritual, and social health, and how impaired that social piece was through this pandemic. And really, you brought up in the break, and it was something that, I really, really gravitated to, was that whole think far, concept, and that is, getting rid of those negative thoughts. I really want to talk, or at least turn the mic over to you to really talk a little bit more about that. And you also mentioned that you have a life coach too, which is something I think that every single one of us, including people like me, that I'm very, very inspired, and I'm, I feel like I don't need it, but I think all of us do.
I think all of us need life coaches. Life coach, our life coach is very inspiring himself. And the focus is more on how to deal with issues coming up rather than, being in the past. It is how to face things today that will impact tomorrow. So the concept of think far, TFAR, negative thoughts lead to negative feelings, negative actions, and negative results. So whenever you have negative thoughts come up which are useless, unnecessary, or negative, you should be able to push the SOS button. The first S stands for stop. So just stop that negative thought for a second, observe or kind of evaluate based on your past experiences, and then shift the focus. So press the Control Alt Delete button and shift those thoughts. So if you are able to fake it till you make it, like I tell my patients, you have to make an effort to do it, and you will fail.
Right.
But slowly you make it as part of your routine, and you are able to stop those negative and useless negative thoughts. Then the feeling is better and the result is better. And of course, this is based on the teachings in almost all religious texts, etc. I like to read the Gita, the Hindu religious text, and that is the basis of all actions. So that is one aspect that I totally believe in.
Oh, I believe in it too. I really do. And before you go on, I would imagine your life coach was really busy over this last year.
Very busy.
I mean, the fact that people didn't have those social interactions and how important they are to humans.
Absolutely.
And having that ability for your patients to be able to reach out to your life coach and I'm assuming that if I'm in your practice, this is what comes along with it. It's not like an extra charge,
And it's a free service.
Yeah,
it's a free service. So whenever we are assessing our patients and we see there's a requirement, right from teenage issues to marital issues to anxiety, depression. I've had patients even in their 60s, 70s having marital issues, problems with dealing with issues from the past, etc. Now, the pandemic has brought time in people's hands to kind of reminiscence more about their past, etc., and are living at home with their spouses more than before. So I think this has led to some issues which are very unique to these times. So I think the effects of the pandemic have been, immense, not just the direct effect of the COVID, but also the indirect.
Well, you did say something too before we even started the show was the fact that I'd shared with you that I lost my stepmom to cancer, and you said we're going to see a lot of this, because everybody hit the pause button to seeing their physicians and really taking care of their health care, and you said something to the fact that this isn't going to be something that we're going to see for a year. We're going to see this for many years.
Absolutely. So as we focus on COVID and its devastation, the spillover effects is more on the non-COVID patients. Delayed care, foregone care, missed care. This is going to accumulate over time, and the long-term effects due to the neglect of the known and the undiagnosed conditions is going to be immense. There is a study out which says that in 10 years, the breast cancer, colon cancers will be more than 10,000 extra patients a year than they are now. Wow. Because we are not doing the
screening.
The
screening.
Canceling elective procedures, the mammograms, the colonoscopies, the vaccinations. There is a 30% decrease by patients to seek routine care and 12% to urgent care also. Heart attacks, strokes, they are not coming to the hospitals as they should. So I think the effect is going to be immense.
And we're talking about the effects. When you were here in June, we were talking about telemedicine. And I know we may seem like we're all over the board, but I want to pivot to that because you were able to adopt telemedicine. You were talking about it then, but wow, a whole year has passed by, and we talked about how things have just opened up very recently. But I want to really have you talk about telemedicine and how that has been able to been an ability to stay in touch with your patients, but also something that you might decide to keep as a component of your practice.
If necessity is the mother of invention, desperation is its father. So these were desperate times.
Yes, they were.
And I think all of us learned telemedicine, use of all these the computers, etc., including our older population, very, very well. I think as I reflect upon year of 2020, it is without question highlighted and underscored as the most significant year in my lifetime. And thus far, actually, regarding the healthcare industry's response to the desperation generated by COVID, because they have stepped up to the plate, and the freedom with which we have been able to use telemedicine, including using just the phones, the iPhones, etc., or the phones to talk to patients who are not adept at using the equipment, etc., has been very innovative. And I think what we have learned is that there are times when patients don't really need to come to the office, and so many man hours are saved. People can just take a call at work, don't have to miss work to come to a doctor's office, etc. And in fact, in my practice, our practice has grown as far as the effect that we have had in discussing issues on the phone. Same with the dietitian, the life coach, the psychologist, our diet, all the things are by telemedicine, and I think we have done a good job.
No, I think you have too. We're winding down our first half here, and I got to tell you, I know that you have a lot of older adults in your practice, and so many, because of insurance, requires you to go ahead and see your physician to get an update on your prescription. Say you have a patient that's taking Coumadin, right? I mean, it's so nice to not have them have to get ready and come and sit in your waiting room and then sit in your exam room, where you could just have a 10-minute visit on a teleconference and meet that requirement from the healthcare insurance company and be done with that.
Absolutely.
Well, we're at halftime here at Health Futures. I got Dr. Ashish Sachdeva here in the studio from Pinnacle Care Internal Medicine. Stick around. We got a whole lot more to cover. We'll be right back.
Being in control of your money provides freedom. Learn how to make it, spend it, and invest it. We're Money Radio 1510 and 105.3 FM.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and we're coming at you live from the Money Radio Studios in Scottsdale Air Park. It is May 28th. I didn't say that at the top of the hour, but I will tell you that Dr. Ashish Sachdeva is right here in the studio with me, and I want to wish you, Dr. Sachdeva, and all our listeners a happy Memorial Day weekend. And I know there are a lot of people that are in their cars right now, and they're traveling to destinations, whether it be west or north. Just be very safe. Be safe, and have a great time, and enjoy that time off.
Absolutely.
So if you're just tuning in, we had two incredible segments, and you can find them up on our website at cypresshomecare.com. You can click on the media button, third button down as radio show, and you can catch those two segments and many, many more. The thing I love about what you're doing, Dr. Sachdeva, is that you really believe in the whole person. You talk about it the last time you were here back in June of 2020, and you kicked off our show talking about that whole mental, spiritual, social, physical medicine that you practice. And I love the fact that you have such a robust team. You have soon to be 3 locations that you operate out of. You have social workers, you have health coaches, life coaches, if you would. You also do phone calls, and I shared with you, our listeners, about a phone call, or not a phone call, but you received a text from a patient at 3:45 a.m. and you responded right to them. But you do these group phone calls that you told me about during the break, and I would love for you to talk about it, because I love your thinking. You're not just a one and done. You think about the whole person.
Thank you. So, I think the group phone calls idea came as the telemedicine grew. And if a patient has a same diagnosis like diabetes or hypertension or memory issues, so it's better to get 6 or 7 or 8 patients together on a Zoom call or on just the FaceTime call, and to give them a 5 or 10 minute idea about their issues, which is common to everyone, and then let them ask individual questions, which actually almost works like a support group. So each question that one person asks is relevant for the other people as well, and everyone benefits.
I love it.
So a half an hour call, and you have 6 or 8 patients on the call, I think has a lot of value. So I think that is the whole vision behind it. But it is something that Medicare and lots of other insurances also allow. So we have used that.
I love that, and I also love the fact that you have also other services that you provide to your patients. You mentioned to me pharmacy. You mentioned to me a hyperbaric chamber. Can you talk to us a little bit about that?
Sure. I think, our dementia program, we have a program that we had discussed last year, which has grown immensely. So we have a program based on artificial intelligence, as well as we are partnering with Sonora Quest Laboratories, as well as a company out of Raleigh, North Carolina, the U Method program. So we have patients who either self-report or their significant others report memory issues, even short-term memory issues. We have a neuropsychological evaluation in the office, a computerized one, as well as a live person. And then we have blood tests done which check for all the reversible causes possible for memory impairment. As we know, Alzheimer's has a genetic component as well as a non-genetic component. So the genetics we can't really change. So what we can do is to change the non-genetic reversible causes,
Right.
which could be simple like diabetes, hypertension, lifestyle, stress reduction, diet. Very much we have a dietitian who just focuses on the mind diet. It's called the mind diet, which is actually Mediterranean-based DASH diet. So we spend a lot of time talking about those kinds of diets, high in avocados and olives and all the
includes wine too.
Oh yeah, red wine. So that is
4-ounce glass, no more, right?
Absolutely, absolutely. So we do these blood tests and we get them back, and through these algorithms that the artificial intelligence has put up, it spills out anything that is high or low, any medication, drug-to-drug interactions that could be causing a brain fog in the patient. And they come up with recommendations. So we go over these recommendations with patients. And I think in the long run, to give you a simple example, suppose the homocysteine level is high in a patient. Now, homocysteine is a chemical in the body that is changed into more active things which are important for the body by the presence of vitamin B6, vitamin B12, something like tetrahydrofolate. Now, if the homocysteine levels are high, they affect the memory center in the brain, cause inflammation. And when you have inflammation, you have all these abnormal proteins that accumulate in the brain, the beta amyloid protein, the tau protein. And we, just by having these patients take the vitamin B6, vitamin B12, and the methyl tetrahydrofolate, we are able to bring down the homocysteine level, or also by using something like N-acetylcysteine. So we focus on things that are reversible, and also not only focus on this part, but also on the lifestyle changes like we talked about. The diet, the life coaching part, the sleep part, where we focus on having patients sleep for at least 8 hours a night, because when the person goes into deep sleep, only then is the brain shutting down and resting and cleaning itself of all the, the bad things that accumulate in the brain, the bad amyloid protein, the tau proteins, the, insoluble proteins. So also a big focus on fasting. 12 hours at least of fasting between your last meal and the next morning.
I hear so much about that. And I know a lot of people are doing 16-hour fasts.
Yeah, that's the intermittent fasting.
And you recommend that?
Absolutely. Because when you fast, you go into a stage of autophagy where your brain then is cleaned up of all these insoluble proteins, the bad proteins like the amyloid and the tau proteins, and cleaned off of these things from your brain, and help because when people with Alzheimer's, when we have done autopsies of these patients, we have found them to have these proteins.
Right.
So if you can clean it off in your lifetime, then it's going to put off the chances of having the dementia. Now, we also have added in our office the hyperbaric oxygen chamber. I was so impressed by the data that I saw that decided to make a very
significant investment. Those aren't cheap.
They're not cheap. So and I could see,
You didn't buy it on eBay, did you?
No. I could see my office administrator raising her eyebrows, but I had my way. So
and it's not easy to get it in the door. I mean, you had to probably
Yeah. So we have the chamber in the office, and the whole concept of hyperbaric oxygen is pushing in extra strong oxygen at maybe 3 atmospheres pressure, when normally you have it at 1 atmosphere. So when you push it with pressure, the oxygen goes into the cellular level and helps with healing at the cellular level. So it acts like you have the healing right at that mitochondrial level, and it helps with healing not only of wounds, but of for depression, for dementia, for post-traumatic stress, for post-traumatic brain injuries. And I have reviewed some data out of China and also the armed forces. The armed forces use it a lot for post-traumatic stress as well as for brain injuries.
Wow.
And so I have patients that I have started using it on who swear by it. And I have a gentleman who is also a close friend and a patient who was recently diagnosed with ALS. And he's using it, and he feels so much better. And it's such
so nice to hear.
Yeah, it's such a pleasure to see him smiling and seeing the benefit. And
such a horrible diagnosis.
Yes, absolutely.
It really is hard.
But memory problems, I have many patients who have started to use it. They're loving it. And I think it just makes sense to embrace all the things that we can into our armamentarium for this deadly, disease.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and we are in our 4th segment. If you're just tuning in, I've got Dr. Ashish Sachdeva here. He is one of the founders, along with his wife, of Pinnacle Care Internal Medicine. Dr. Sachdeva, if somebody wanted to reach out to you, I gave the email address, pinnacleinternalmedicine.net, but how would they call you?
They can reach out to the office at 623-249-2100.
And by the way, it's pinnaclecareinternalmedicine.net.
Yeah.
So when we left off on our 3rd segment, we were talking about a lot of things, and I'm just very fascinated by the fact that you do fasting and recommend it, and this U method test, which is a test that NorQuest is doing, and it really tests a lot of markers, inflammation being one of those.
Excuse me.
That's okay.
We do. So I think there are almost 55 elements that we check. Like I said, homocysteine levels, zinc levels, iron levels. We look for inflammation, C-reactive protein. So when you have inflammation in any part of your body, it is bound to have effects also on your brain. And when you have inflammation in the brain, you have accumulation of all these bad proteins.
Right.
And also
amyloid.
And
amyloid,
tau protein.
Yep.
Yeah. So you are bound to have long-term effects. So when you have these elevated C-reactive proteins, I'm also a very big proponent for natural things. So turmeric is something that I advise almost all my patients. So if you like turmeric in your diet, like most of us Indians do, but it's best taken with fat, good fat, with olive oil
Not
or
bacon,
anything.
Not bacon, olive oil.
Olive oil, etc. Or you have the active ingredient called as curcumin, and 500 milligrams of curcumin comes as a capsule form. You can take, you can take that. once a day. And then ginger extract is something that we also recommend very highly. So these natural things help bring the inflammation down, and also look for the factors which are causing the inflammation. So we check, it's like 55 things that we check, and the report that we get back has a very comprehensive analysis and recommendation of what would help alleviate those things.
I would imagine that so many of your patients are having inflammation and they don't even know. Is it almost a standard that you say, hey, you know what, I want to do this blood test, this U method blood test on you? Or are you looking for symptoms on them to really come to that point?
So I have developed some questions that I do in my annual visit once a year when we do our annual wellness visit. So we have developed over the years 35 questions right from head to toe. Assessing right down from, their vision, their hearing, their dental problems, their vaccinations, their balance. We check their balance in the office also. Any heart issues, shortness of breath. So just routine questions, smokers.
Sure.
Yeah. So whenever we find issues with, self-reported short-term memory problems, or even the family is reporting it. But I have had many of my physician colleagues who happen to be my patients, or nurse practitioners, etc., who are our patients, want it. So
Right.
I have, whenever I talk about it to my friends, colleagues, and patients, or I do it for the older population and their children want to, in their 50s, want it done. I think that is the way to go, to catch the problem before it becomes a problem.
Exactly. No, I'm fascinated by it, and I'm certainly going to talk to my primary care physician and ask that one of those get ordered for me.
Excellent.
So as we wind down our show, is there a question that I haven't asked? Is there anything you would like us to cover? Leave a lasting memory with our listeners about you, your practice, but more importantly, the health and well-being of our community as a whole.
I think the main focus that I would like people to have even now is on the indirect effects of this pandemic on their health. They should not give up on their basic health issues like screening issues, the isolation. If they're feeling isolation, depression, they should reach out. And many of the practices have had to close down and have had reduction in staff, which is causing problems. There is also a problem because of unemployment or loss of employer-given insurance. So the affordability is a problem. So I think the whole system has to rise up to the occasion now. And so the people with chronic conditions like diabetes, hypertension, heart disease, depression, if they're not coming for routine regular care, and long-term health effects will ultimately show up. So
Sure.
we have to make sure that people realize that all the other things will go hand in hand. And especially also for children, vaccination follow-ups or lead screenings. This will lead to resurgence of certain infections, etc., which we have got over. And I think the whole system should come up and also focus not only on the physical, mental issues, but also the impact on education attainment, employment outcomes. So I think it's a whole community based approach that we all have to feel responsible for. So
No, and you've really outlined a lot of the issues that we're all dealing with, and certainly, like I said when we first started the show, you inspire me. Your passion just it oozes out of you, and I, like I said, if you were here on the East Side, I would definitely be engaging you as a primary care physician because you do such a great job for your patients.
thank you.
So we've identified all these issues. I mean, certainly once we know we have these issues, we need to go to get them solved. We've got to go visit a primary care physician or a specialist to address these issues that we're dealing with.
And like I said, just to put it back in a nutshell, it will take the whole village to raise these individuals who are going to be affected. And it is important to align all our efforts between the primary care doctors, the community resources, the state, national, and also the corporations and the foundations that can put all this together. In my research, I found only one state, the North Carolina Medicaid program, where they have a plan that has been put together. They have a common assessment tool for the social determinants of health, and it is manned by just one vendor. So there is no complication of looking for data in different places. So everyone has access to the social determinants that can affect the health.
Right.
So when a patient comes to the hospital, you are looking at the same data.
No, I hear you loud and clear. I will tell you, I love how you do physical, mental, spiritual, and social, health. You really look at the whole mind, body, and spirit of people. You've taught me a lot. I've learned about this U method. Fasting is really important. Really measuring your inflammation and really making sure that you don't have that. We need to do that. We also need to take a lot of noise out. We need to breathe. I remember you telling that last time. Meditation is so important.
Absolutely. Deep breathing, positive thoughts, absolutely essential. Meditation.
And SOS. Stop, observe, and shift that mindset.
Control, alt, and delete all unnecessary, useless, and negative thoughts.
I love it. Dr. Sachdeva, I got to have you back. I'm inspired. I'm looking forward to a great Memorial Day weekend. I hope everyone else is. Thank you for joining me today.
Thank you so much. It's my pleasure.
Make it a great day. You too.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.